Hello, everyone, and thank you for joining us on Go Ed Tech Go. We have respiratory therapist Juan Salas. Juan works at Keck Hospital. Is that correct? Did I say that right?
That is correct. Keck Hospital of USC.
At USC. Juan is a former student of mine. When I taught at DeWarty, Juan was one of my students, and we're going to talk to him today about respiratory therapy and the field of respiratory therapy, along with some of the things that we're doing in class and his kind of his road into physical or respiratory therapy. So Juan, thanks for joining us today. We appreciate you taking out your time. I know that you are on nights now, and you have a couple hours of sleep. So we really appreciate your time because we know this is super hectic time, which we'll talk a little bit about too during this COVID time. So Juan, let's kind of just jump in. I've known you for a long time, so I think this is going to kind of flow on its own. But can you talk to us? I know that you didn't take a direct route in, right? There's a lot of people who take a direct route, and there's also a lot of people who don't take a direct route in. So can you talk a little bit about the route that you took to get into respiratory therapy?
For sure. Yeah. So, hey, my dog here. Yeah. So, like you said, I was a student of yours over at DeWarty High School. And when I graduated, I went to the local community college because I wasn't too sure what I wanted to do yet when I was, when I graduated high school, which I'm sure a lot of your students are in that state. So was taking general eds. I played soccer there for a couple of years and then decided I wanted to do nursing. I'm like, hey, let me choose a field in the medical field, and then did a little bit more research, decided I want to do respiratory instead. And so in order to kind of get my foot in the door into healthcare, I did my CNA license, which is a certified nurse assistant license, worked at a nursing home for a few months so that I can get a job at a hospital, because that's usually how it goes. So worked at a nursing home, then went to Methodist Hospital in Arcadia, worked there for a bit. And then that's when I went to respiratory school. And then it's an associate's degree. And then from there, was still working as a nurse assistant at USC, and then finally got into the respiratory once I graduated and all that. So not a direct route, like you said, but it was kind of like one thing led to another. It was kind of strategic planning, I would say, on my part, because I wanted to kind of optimize my chances of getting into a good hospital to work in. So that was kind of what I did.
Great. So can you also talk about what degrees you have? Because you listed a whole bunch of stuff. You went through all these steps.
Sure.
Degrees. What do you hold right now? Because you're working. Are you working in ER? Are you working in the regular hospital?
Okay, so USC Keck Hospital, USC doesn't have an ER. So we're a private hospital that does procedures. We get admissions. So it's not like your typical community hospital. So the degree that I have is an associate's degree in respiratory therapy. And with that, I need my RCP license to be a practitioner. And then there's two licensing exams. The first is your CRT, certified respiratory therapist, and then the other one, I guess more advanced one, is the registered respiratory therapist, RRT. And so with those two, you're pretty much able to work at any hospital, along with your BLS, the basic life support, ACLS, advanced life support, and then your PALS, that's the pediatric life support. So those are the licenses that I have, the ACLS, BLS, CRT, RRT, and then my RT license. And so those need to be updated every couple of years when you continue in education to keep the license active.
Nice. It's interesting you talk about how you had kind of like that strategy as you tried to become a respiratory therapist. The students in my English class are working on a resume. So they try to find actual medical careers that are out there right now and try to tailor a resume, like an ideal resume, to match that job description. And so a lot of it's funny looking at it because it'll say, these are the duties that you must have. And then here are the licenses. And a lot of times they're listed. You need these different licenses, these different certifications, this many years of experience. And so for somebody with the wanting to pursue like that medical professional job, a lot of times there are stepping stones to get there. And so I think the question I have for you to kind of think about is at what point did you realize, hey, this is really worth it? I really want to like pursue this? Because I know, being a respiratory therapist is great now, but I'm sure working at the nursing home may not have been your ideal situation and work in that sense. So how did you get through that hard early stages to now get to where you want to be?
It was all for the greater good, I guess you can say. I mean, when I was working at the nursing home, well, because see, the thing is, like when you have it, like starting off, right? When I first started in the medical field, the CNA license, right? That takes like 2 months to get, right? And you can't really get hired in a hospital right away as a new grad CNA typically. So you kind of, that's like the general route. You get into the CNA, you work at a nursing home, get some experience so that you can work in a hospital. And then the advantages of working in the hospital, because I wanted to go to school and continue to work, was the 12-hour shifts. So that was kind of the route that I wanted to take. So once I got into that hospital setting, it was also kind of like looking into the future. When I graduate respiratory, I can already be working in a hospital. So it'll just be a smooth transition. So I was looking at having the advantage over my classmates really in terms of getting a job, because it's the job market's going to be tight. Because, for example, RTs arguably have an equivalent of working at a nursing home. So like they're called subacutes, right? And they typically pay a lot less than a hospital. And a lot of RTs have to kind of get that experience before they can get into a nice hospital. But I kind of wanted to like jump track that. And so that's why I became a CNA and was already in the hospital setting. And it was definitely beneficial because a lot of the stuff that we were talking about in class, like I was seeing it already firsthand. So I think it helped me academically. It helped, I had access to the medical records, patients' charts, constantly just looking up like acronyms and all this stuff. Because when we read a patient's charts, like every other word is an acronym, And so I just remember just like being a CNA, and just looking at the patient's charts and like, okay, looking up what this is, looking up what that is. And I just had all these resources, and it was my way of kind of getting that edge. It's like Gomez when I was cross country. I was the number one for you. It's because I was waking up early and training in the morning. So I kind of took that kind of work ethic, or kind of doing that little extra to try to get ahead, get an advantage, because it's a hard job market. So that was kind of my route. I don't know if that answers your question.
It does. That was good.
Now,
thank you. 2 hours of sleep.
And I think it's important to go back and talk about what you talked about. You said, the ultimate goal was to do this. There were sacrifices you had to make. It wasn't always fun. People see the 12-hour shifts. You work 3 days a week, probably more than that now. But that ultimately was the goal, and it took you to doing some things that you didn't want to do. You had to sacrifice. You had to do things you didn't want to do to get to where you wanted to go. And having that plan was a good thing. Sometimes it takes people longer. Sometimes it doesn't take as long, depending on what route you take. But with that said, ultimately you wanted to be a respiratory therapist, which you are. And so, what are your job responsibilities now? If you could give us like a few things that, your job responsibilities cover on a day-to-day basis. When you walk into Keck, maybe pre-COVID, what did that look like? And then maybe we can kind of jump back to that.
Okay, for sure. I mean, the pre-COVID and post-COVID, like my job hasn't changed too much, arguably, but so I'll come in the morning. There's usually an assignment, right? I'll have my assignment, my patient list. I typically work in the ICU probably 90% of the time in the ICU. So I'll get my assignment, I'll see my patients, and then I'll find the therapist the night shift therapist or the day shift therapist now, who had those patients, and then we'll get a report. They'll kind of give me a quick run through of the evening, a quick little history, what the plan is for the day, and then I'll go look at the patient's orders. If there's any medications I need to administer, I'll go get the medications, and then I'll just go through my list of the patients that I need to see. And my responsibilities are like, so what we do basically is we manage artificial airways is one. We manage mechanical ventilation is another. So if a patient is, we have to assess to see, like if a patient is short of breath, we need to assess why is the patient short of breath, right? We have assessment tools. We can listen to breath sounds. We can draw blood to see how they're oxygenating. And then if the patient is, say, hypoxic, right, is low on oxygen, then we have a lot of tools that we can use to help the patient. So oxygen delivery devices. So we will decide, as part of the healthcare team with the physicians and the nurses, but we're the experts in terms of the oxygen delivery device that the patient is going to need to assist them. And we can go from a simple nasal cannula, giving 2 liters to 1 liters of oxygen, right? All the way up to, we have COVID patients on 60 liters a minute on 100% oxygen. We're talking 60 liters a minute. That's a liter a second, right? Of 100% oxygen just blasting into their nares, which is kind of crazy, right? Like a liter a second, right? And then that's pretty much. And then another thing we have to do is we assess the readiness for extubation, right? To me, that's one of the most important things we do, because my goal when I come in is to take patients off of the ventilators, right? To give patients the minimal amount of support that's necessary, because everything that we do has negative consequences, right? Oxygen has negative consequences. You can develop oxygen toxicity. There's a lot of stuff, and even mechanical ventilation has a ton of negative consequences. Infection, what we call barrel trauma, damaging to the lungs, because it's not a natural thing to be breathing with positive pressure. It destroys the lungs over time, especially when a patient needs higher care. We go higher pressures, higher oxygen concentrations. So it's this balancing act of making sure the patient is oxygenated and ventilated without destroying their lungs any further. So that's kind of some of the responsibilities at the hospital. Also, we give breathing medications, albuterol, Atrovent, those kinds of like asthma type medications. If we work in the ER, right? I have worked in the ER when I worked at Antelope Valley over in your neck of the woods. We assist intubations. RTs can do a variety of different things. I'm kind of babbling here. I don't know. So yeah, that's part of why I like respiratory so much. What is that? The thing you call me, Gomez?
The jack of all trades, the master of none.
Yeah, which is great.
I used to call you that when I knew you when you were like 14 to 18, but now I think you might be the master of respiratory therapy.
There you go, master of
Oh man, I have a lot to learn. But thank you. I thank you, man. There's a lot. There's always more to know. I don't consider myself an expert, but thank you. So those are some of my responsibilities. I don't know if that answers your question. So we can, any given day, I can be in OR, I can be in ICU, I can be in the COVID ICU, in the COVID step down. I also work at Norris Hospital, which is affiliated with USC, which is the cancer hospital. So which is great for me because it's not terribly repetitive, I suppose, which is cool. I like it.
Yeah, definitely. So it's cool to hear kind of like the broad overview of what you do. obviously a lot goes into your job. I think when you walk in in the morning, right, or at night, I guess at this point,
Yeah.
you probably don't know what to expect, right? You don't know
Yeah.
who's going to be in the bed, and so to kind of make it maybe a little bit real right now is if you could think of maybe in the past, I don't know, month, week to last night, whatever,
Okay.
like a specific case or specific patient that you were dealing with that was memorable to you. Maybe how you went from when you first took the patient on to when you handed the patient off to the next shift.
Like, for example, tonight when I came in, let's just say, it was like 6:15, just finished report, and it was like code blue 5 East. And it's like, hey, I have a patient in 5 East, right? Code blue 5 East, it could be my patient. When I show up, they're doing CPR, right? We're doing CPR on a guy right away.
What is code blue?
Oh, I'm sorry. Code blue is someone's going into like failure, like either respiratory failure or cardiac failure. Usually, you know, they need to be resuscitated essentially, or they need to get people there to assess if they need to resuscitate. And so when I showed up, you know, the patient's laying there, and it wasn't a good outcome. You know, we did CPR for 20 minutes, and then the patient passed, unfortunately. So that's the reality of the job. But maybe that's not the best story. Maybe we can edit that one out.
Just like picture though, like
it's just because like,
oh, no.
dude, like these days with like the COVID patients, they're declining. They decline pretty quickly, and when they're in the ICU, it's like they're on the ventilators, and like I just, you know, I would watch the news, and you know, they'd be talking about we need ventilators, but the truth is, it's like once you're a COVID patient on a ventilator, it's not looking good. Not many patients get off of the ventilator. That's just the reality of it. But
well, Juan, you know, it's funny
yeah.
because they say they need more ventilators, but are the ventilators that good if they don't have the respiratory therapists?
No, the ventilators will pretty much destroy the lungs, especially, yeah, like, so it's kind of the way a mechanical ventilator kind of works is kind of like the environment that we're living in, right? Barometric pressure is at, you know, 760, 21% oxygen, right? And that's enough pressure gradient for us to have that gas exchange, right? Through the alveoli into the capillary beds. And so with COVID, what's happening is, and other, you know, respiratory diseases is there starts to develop like a barrier to that oxygen, to that ventilation. Then they develop what's called acute respiratory distress syndrome, right? So, simply stated, the lungs fill with fluid. You lose your surfactant, so the lungs lose their compliance, and then there's this huge barrier to oxygenate. So the way we do it is like we increase the pressure, right? We intubate them with an endotracheal tube, right, to protect their airway, and then we hook them up to a mechanical ventilator. And the way we're doing it, you know, in relation to that lab that you guys do, right, talking about tidal volume, we deliver a tidal volume that's going to try to protect the lung. So what we do is lung protective strategy. So low tidal volume with a higher rate. I don't know if that makes sense.
Yeah, and I want to kind of talk about that because I sent you the video that we did on lung volumes, right? And right now we can't really do that lab. I'm lucky enough that my daughter is a student who comes in and can do these videos for us. But with that said, it's important to note that we still are able to do that lab through that process. But I sent you that lab video to kind of look at so that you could look at it. And we talked about tidal volumes, how much you take in per minute, and then, you know, the expiratory reserve and inspiratory reserve. And so within there, we talked a little bit about that lab. And you just kind of tell us what you said about that lab and, you know.
Oh, for sure.
exposure to it?
Yeah, I remember the first year you showed me that lab when I went and did the first career fair with you guys. I did that lab when I was in college. You know, that's like, to me that seemed, you know, pretty advanced, which is, you know, pretty cool for your students. I think you're exposing them to some pretty advanced stuff, and they're able to handle it. It tells me your kids are pretty smart. You know, so that's pretty real world stuff. Like what you're essentially doing is like a bedside spirometry, like a basic bedside spirometry. Because we have another part of what respiratory therapists do is we can work in a pulmonary function lab. And so imagine doing that same procedure, but you're like enclosed in a little like enclosure. Like imagine like a little porta potty, right, with glass that's all sealed up. So it's like super accurate. So yeah, I think it's really cool what you guys are doing, and it has some real world applications, you know, that we do. So definitely really cool.
Yeah,
Like when you talk about, go ahead.
And you know, we're talking about these are sophomores, right? So
Mm-hmm.
you know, the exposure is good and it gets people excited about it. But I like to always tell them, hey, the things that we're doing here are things that are applicable. Like you can take this skill, like you said, there's people who do that. You know,
Yeah.
you can go into the field and you can take that skill that we taught you right here, and you can take it and use it in that situation.
Yeah. 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 And then if you go to respiratory school, you'll have an advantage. You know, talking about RV and VT and vital capacity. I mean, we test vital here, for example, like you can do, like, as a respiratory therapist, we would do that test and test a patient's vital capacity as a way to measure their, like, for example, a patient who has neuromuscular disease, you know, like ALS or any Guillain-Barré, like, you know, there's an estimated vital capacity, right, for the patient's ideal body weight, you know, that we calculate for the patient's height, right? So the estimated vital capacity. And if their vital capacity goes down a certain threshold, that is an indication of impending respiratory failure, right? So a vital capacity, along with other measurements, including what's called a NIF, a negative inspiratory force. Like, so how much pressure, how much negative pressure can the patient generate? You know, they have to aspirate against, you know, a pressure valve essentially, and there's a certain threshold. Negative 20 is the threshold, and if they don't have enough respiratory strength to generate that, then they can't protect their airway. They can't generate, you know, an effective cough, and that's impending respiratory failure. And we also use those measurements when we're weaning the patient off of the mechanical ventilator. So yeah, real world applications that we use, you know, every day, you know, pretty much. So really cool. Yeah.
So I have.
Oh, and go ahead.
Question.
I thought about a patient, a pretty remarkable patient, to answer your question from earlier.
Hmm?
Yeah. So this patient came in prior to COVID. So she was, I think, 32. So she came in probably, I remember she spent Christmas at the hospital around there. And so she had she had influenza A, right? So every year we have patients come in with the flu, you know, and they require mechanical ventilation. It takes them out, right? And so this young girl, she was 32 years old, and she was intubated. Eventually, you know, had to put a trach because she was intubated for so long. And then, you know, it escalated all the way to what's called ECMO, extracorporeal membrane oxygenation. And so at that point, there, you know, we put big like hoses, catheters into the vein here, and we extract the blood, we pump out the blood, and then we oxygenate it outside of the body, and then oxygenate and ventilate outside of the body, and then we bring it back to the body. And so this poor girl, like, family was always at bedside prior to COVID, and then COVID hit, and she was there day after day, week after week. And then little by little, and then her kidneys went out, and so she was listed for a kidney, listed for lungs. Young girl with a family, 32 years old. You know, and then COVID hit, right? And she's unaware of everything, right? She's sedated, she's out. And then little by little, she started getting better, and people aren't supposed to get better from that, you know. Um, Eventually she was able to get off of ECMO, and then hey, her kidneys bounced back. And so she went from being listed for a lung and kidney transplant. Then next thing you know, she's breathing on her own. She has just what's called a trach collar, and then she starts working with speech therapy. Then she starts talking. This girl's a freaking miracle, absolute miracle. And I think she was discharged from the hospital, went home, maybe, I don't know, something like June, maybe like summer. So she spent like last Christmas, all through New Year's holidays, all COVID. And yeah, she went home. It was a different world when she came home, but she went home. That girl's a miracle.
That's awesome.
No doubt about it. That girl's a miracle.
And I feel like it's stories like that that really inspire, I think, people to even get into the medical field as well. And I remember, I think it was 2 years ago, you came in and gave your presentation to Mr. Gomez's class, and we had a student that day. I think to this day still, he's like, that's what I want to do, respiratory therapy. That's what I want to do. And so I think with that in mind, I think you met the kid. With that in mind, everything, like with your experience, I'm sure there's going to be students who listen to this and say, hey, I'd like to know more about this. So what advice would you give to somebody who's, let's say, 15 in biomed and they're excited about maybe a career in respiratory therapy? What advice would you give them now, or when you were 15, let's say? Like, what advice would you give to yourself when you were 15?
I think it's a smart choice for sure. The way I did it, I went to a private school, so it was accelerated. It was short. I was in and out in 18 months, which is remarkable, But then, I left with a big debt, right? Some student debt. So I guess what they have to assess, like, what route they want to take, like how fast do they want it, right? They can go to a community college, and Antelope Valley College. They can do all their prerequisites there, all your sciences, all your math, all your English, and then get into the respiratory program. And then you'll be done within 4 or 5 years, no, maybe like 4 years, 3 years. So I would say do your research, whether a public community college is right for you, or to try out one of the private schools. For a kid who's fresh out of high school, like, I don't know if I could have handled it fresh out of high school. The mental toughness it would have taken, to deal with all the things that I had to see and do. But, I'd like to think people will rise to the occasion. I guess I did. I didn't think I'd be able to, like, be a CNA, assist patients, to the restroom, shower patients, all that stuff. But if you have a goal, if you have a goal in mind to be a respiratory therapist, go for it. It's a great field. It's a trade, essentially. And you'll have a job. It's recession proof. It's pandemic proof. But yeah, I would say, here's a good one. Volunteer in a hospital. If you can, volunteer in a hospital, kind of get a feel for the medical setting. And if they can take the route that I did, is if you want a medical job right away, CNA is like real quick. And to me, it's one of the most noble jobs an individual can have. You're caring for patients who who need the most help, you know. And it's just basic life stuff, you know, activities of daily living, you know, bathing and everything. And it's like you said, it's not the most glamorous, but it's one of the most noble things you can do for sure. And I don't know if that answers your question, but yeah, yeah.
Well, Juan, we want to thank you for, first
Okay.
of all, taking time out of your busy schedule. We know that the medical profession right now is just blowing up. You guys got a lot of things to take care of, and you're really doing, you're doing everybody a service. You guys are normally heroes, but you guys have just proven how much more of a hero stance you can take during these times to keep everybody safe. We really do appreciate you. Thanks for giving our kids really the one spectrum to another, so they really understand the profession.
Okay.
And we really appreciate you. And thanks to everybody for joining us on Go EdTech Go and with the Eastside Biomed program to bring you this career journal for a respiratory therapist.
See you, Juan.
All right. See you guys. Thank you so much.
Every breath you take.